Stories of Transformation, NRCDV Radio podcast production, has been highlighting the work of advocates and their life stories. We have interviewed young activists, advocates, survivors, and government officials, all committed to ending gender-based violence. I am Yvonne Ortiz, and my guest today is Shania Goodman, Policy Director for NRCDV. This past January, NRCDV released a report titled The Difference Between Surviving and Not Surviving Public Benefits Programs and Domestic and Sexual Violence Economic Security, written by Shania. The report explores the importance of public safety net programs in the journey of domestic violence survivors. It can be viewed and downloaded from our online resource library, bonnet.org.
Welcome to our show, and congratulations, Shania.
Thanks, Yvonne. I'm excited to talk about the report.
It's great to have one of our own. We usually are interviewing, people that we collaborate with, but just having one of our own, it's really exciting. So, as I mentioned, we've been focusing on life stories, and our listeners love learning a little bit about ourselves. And before we start talking about this amazing publication, can you tell us a little bit about yourself? Tell us about your journey in the domestic violence movement. What motivated you to join the movement?
Sure. So I became inspired to do this work when I was in college. I had an incredible professor who taught a class on domestic and sexual violence, and I just remember sitting in that class and feeling such a connection to this movement. So I've been doing domestic violence work ever since, initially as a volunteer at a transitional housing program. I spent some time as a courtroom advocate, but I've spent most of my time in the movement doing systems level and policy advocacy. Mm-hmm. And the thing that really drew me to the movement, and that is still at the core of why I'm committed to this work, is an effort to really understand and address the complex needs that survivors have that compound or interact with their experiences of violence. And for me, I'm especially interested in issues of economic security and how that intersects with domestic violence, and what economic stability means for the well-being of individuals and families and communities.
Mm-hmm. And I think as advocates, we recognize that the journey of a survivor of domestic violence is not just leaving the relationship. It's so much more. The journey,
exactly.
They need to have a safety net that includes from, a number of supportive services, counseling, access to legal remedies, transitional housing, and of course, today's topic, public benefits. So I can't wait to start talking about the report. So tell me, what was the goal of this report?
So as you just started to say, Yvonne, victims who are low income or living in poverty encounter so many challenges and barriers on their path to safety and well-being. We know that violence or abuse can undermine a victim's ability to work or have a stable place to live. And financial instability can make it really difficult to cope with the physical and psychological impacts of abuse. And for survivors from historically marginalized groups, these barriers and challenges are often even more exacerbated. So, for example, survivors from communities of color, Native Americans, LGBTQ folks, immigrants, people with disabilities experience higher rates of poverty and food insecurity, are more likely to be working in unstable or low-wage jobs, or otherwise experience economic disadvantage. So for those survivors who are, more likely to face economic instability and are also more likely to encounter systemic barriers like institutional racism when they try to get access to things that will help. So all of that is to say that we've known for a long time that this connection between abuse and economic security is really critical. And interestingly, the Centers for Disease Control just recently released some evidence that economic security programs like public benefits can help both prevent and address intimate partner violence. So to get back to your question, the goal of this report was really to explore the role that public benefit programs play in survivors' lives and especially the challenges that survivors encounter when they try to access those programs, and then what we as advocates can do to strengthen those programs.
Great, so interesting. So we know that all this information was collected via survey. When was it developed, the survey, and who were the partners involved?
So this survey actually expands on a survey that we did in 2009 at the National Resource Center, along with some of our colleagues at Legal Momentum. And that 2009 survey focused exclusively on a program called Temporary Assistance for Needy Families, or TANF. Sometimes folks know it as welfare. But in 2017, we really wanted to update the survey and expand the focus beyond TANF to also include the Supplemental Nutrition Assistance Program, which is SNAP. Some folks know it as food stamps, and also unemployment insurance. So we went through a really extensive process to develop and update the survey questions, and we reached out to and involved stakeholders from lots of different national and state level domestic violence and sexual assault organizations, as well as some of our culturally specific partners, so that we could be sure that the survey was really robust and would get some good answers to questions that we were curious about.
Great. So you collaborated with Georgetown Center on Poverty and Inequality. What was the role?
Yeah, the Georgetown Center on Poverty and Inequality was such a fantastic partner in this survey and the report. They have such deep expertise on research and programs and policies related to public benefits specifically, but also economic instability more broadly. So they really helped us develop the survey questions, analyze some of the key data in the report, and then also frame some of the recommendations that we make.
So another question. Why is it so important for victims to have access to public benefits? And also, what are some of the challenges that they encounter?
Yeah, so this question really gets right at the heart of the report. And what we know is that access to public benefit programs is absolutely essential for survivors as they try to establish safety as well as short and long-term stability. Over and over again in the report, advocates shared with us that for survivors, having access to these programs is critical in their decision-making about whether or not they can leave an abusive relationship, or if they can survive safely and provide for themselves and their children on their own. One thing that came up a lot is that we know that many abusive partners, as part of their efforts to maintain power and control, can interfere with or sabotage a victim's ability to have their own financial resources or be economically independent. And as a result of that economic abuse, victims often struggle to meet basic needs for themselves and their kids, needs like food or clothing or housing. And public benefit programs provide a necessary bridge for survivors as they work to get safe, to stay safe, to heal from the abuse, and to get back on their feet. But the other thing that became so clear to us in this is that as essential as these programs are, survivors encounter many challenges and barriers when trying to access them. Some of the challenges are at the level of implementation. Things like caseworkers failing to offer some of the specific exemptions or resources that are available to victims. And other challenges are really at the systems or policy level, things like lack of access to transportation or affordable childcare, which makes it nearly impossible for victims to meet the requirements of these programs, or strict work requirements or requirements to cooperate with child support enforcement that really jeopardize the safety and well-being of survivors and their kids. So those are just some of the barriers.
I was reading the report, and there's an amazing list of key findings. I don't want you to go over each one, but tell us a couple. I want for our listeners to get a taste and get intrigued and go and read the entire report.
Yeah, so the most significant finding is sort of what we've just been talking about, which is that public benefit programs are absolutely essential to survivor safety and economic security. And now we have kind of the hard numbers to back that up. A significant majority of advocates said that TANF and SNAP and unemployment insurance are each a critical resource for victims. Another key finding is that a significant percentage of folks that responded to our survey said, again, speaking to the barriers, that many of the victims that they work with are not able to access these programs when they need them. So again, having those concrete numbers and data that says these programs are often unavailable for folks who are in crisis and who really need them. And the last finding that I'll highlight that really stood out to me is that while many advocates are working on a case-specific basis to help victims navigate these programs, things like, for example, helping victims with the application process, very few advocates are working on an ongoing collaborative way with staff in public benefits programs or working on these issues at all at the systems level. So as a systems and policy person myself, I was really interested in seeing how few folks are working at that level, and I really want to build advocates' capacity to do that systems and policy work.
And I'm glad that you mentioned the advocates. So advocates, including myself, what can we do to address these challenges or barriers?
That's a great question.
Learn more about public benefits. That's the basic one.
That's actually the first thing, because one of the other data points that came up in the survey was that a lot of advocates just didn't know about these programs. So, when we were talking about some of the implementation barriers that are coming up for survivors, one thing that advocates can do is really, get a good understanding of the systems and processes in your state and your local community around applying for these programs. Like, make sure you really understand what requirements are placed on people who apply and what requirements are placed on people who receive services through the program, what exemptions or exceptions are available for victims of domestic violence or sexual assault, like really knowing that. And part of that process is doing outreach and building relationships with the folks in your community who administer TANF or SNAP or unemployment insurance, because building that relationship and those collaborations can go a long way toward addressing some of the barriers that come up or that result from inconsistent implementation and some of the problematic processes or practices that are happening at the front line that harm survivors. So that, I would say, is recommendation number one for advocates. The other thing I would say, for advocates to do to address these barriers is, for the ones that are more systems level, like access to childcare or better access to programs for immigrant victims or mixed status families. The fact that those barriers came up, I think, is a real call to action for us as advocates to get engaged at the systems and policy level. So finding the folks in your community or in your state who are really working on those issues more broadly outside of the domestic violence or assault field, and that are really working to strengthen economic security for families and communities and build those relationships too.
One of the things that I loved about the report is the way that it was formatted, of course, and thanking our great communications department at the NRCDV, but that you have the quotes, and they're called the Voices from the Field, and these quotes are survivors' voices. Advocates' voices. Why was so important to incorporate the advocates' voices into the document?
Yeah, I love those quotes too. I think they give us so much insight into what survivors' experiences really look like. As you said, they're advocates talking to us, but they're, down there on the front lines with survivors every day. And
they are.
Having them tell survivors' stories, I think, is, so powerful. Data and numbers are great, and I'm so appreciative that we had enough responses that we could really kind of have a robust understanding of the data that helps us, describe this issue. But those stories are just so essential in explaining the role that these programs play in survivors' lives. And I loved those quotes so much that we actually took the title of the report from one of the quotes from an advocate who said, quote, Yeah, so the advocate said, quote, for those that need these programs, it is the difference between surviving and not surviving. And I could have written, paragraphs about the connection between domestic violence and economic abuse and poverty and safety. And actually those paragraphs are in the report. But that quote just says it so clearly and so succinctly and so beautifully captures why these programs matter for survivors.
Amazing. That is wonderful. So, Shania, time is running out. So anything else you want our listeners to know about the importance of having access to public benefits for victims and survivors?
Yeah, I want to go back to something that I mentioned at the very beginning of our conversation about the report from the Centers for Disease Control. Mm-hmm. So that report presents some evidence that really mirrors the findings from our study about how access to public benefits can help address and help resolve some of the impact that violence has in survivors' lives. But one thing that this report also includes that I think is just so amazing is evidence that economic security can help prevent intimate partner violence. So access to public benefits programs, as well as to things like tax credits for low-income families or a living wage, and policies like equal pay and paid leave, can actually make individuals and families and communities safer and more secure. So that prevention piece is, I think, pretty new. And the last thing I'll leave our listeners with is, as you're thinking about the work that you're doing, whether it's directly with survivors or at the systems and policy level, to just remember how absolutely critical this economic security piece is, not just to help survivors heal from the violence, but also to really build strong, healthy, safe, stable families and communities.
Thank you so much, Shania. What an important information and work you're doing. I greatly appreciate getting to learn a little bit more about the importance of accessing public benefits programs that can really be the difference between surviving and not surviving. You just listened to Stories of Transformation, an NRCDV Radio podcast production. Thank you again to Shania Goodman for developing and informing us all about this report, which can be viewed and downloaded at bonnet.org. Follow us on Twitter at NRCDV. To hear more NRCDV podcasts and to access additional resources on gender-based violence and related topics, visit nrcdv.org. Stories of Transformation is an NRCDV Radio podcast production brought to you by the National Resource Center on Domestic Violence. Support is provided by the U.S. Department of Health and Human Services, Administration for Children and Families, Family and Youth Services Bureau.